tips and tricks. Karena Wu, she's a board-certified clinical specialist in orthopedic physical therapy.
Karena Wu, owner of ActiveCare Physical Therapy.
So joining us is Karena Wu, a board-certified clinical specialist in orthopedic physical therapy, so she knows what she's talking about.
Dr. Karena Wu from ActiveCare Physical Therapy.
Dr. Karena Wu, I'm here to work on your mobility and physical therapy. I will help you activate your muscles and move your body correctly for your general health, as well as a little rehab when you feel those minor aches and pains. Right arm overhead, feet are hip width apart. We're just going to simply side bend and reach up and over. You're going to feel that stretch on the side. That's your low back. It also affects your shoulder and your posture. And if you twist your chest down a little bit, you're going to get a deeper low back muscle.
Oh, yeah. What's your advice? If you're in the middle, or sometimes people get the neck pillows, I don't know if those work so well.
Well, if you're seated or you get stuck seated, because we know flights are delayed, you want to sit in neutral. So uncross those
like
legs. Do not lean, because all of that leads to the aches and pains when you land.
I have brought in a very good friend, Dr. Karena Wu. She's a physical therapist, going to show us what we can do before we even get out of bed.
So you're going to lie on your back. You're going to give a big overhead stretch, and you're going to really open up the front. That really energizes the front because you're opening up this short area.
So, Karena, when you're trying to exercise and that arthritis pain gets in the way, is that kind of an indication that maybe PT is right for you?
Yes. So when you are supposed to be seeking out your healthcare provider is when you've got a lot of pain that's unchanging and constant. You start getting super stiff and you start getting limited in daily tasks like getting out of bed, walking, stair climbing, bending. That's when you need to schedule. Physical therapy is going to help you with reducing pain and inflammation, increasing mobility, circulation, improving all sorts of stability, strength, and flexibility. You're going to keep your trunk upright. You're going to feel it in this calf here. So keep the heel down on the back, knees stay straight.
You know what it feels like sometimes as we get older? We're so busy trying to burn calories and walk and do all the things. We're not stretching.
By the way,
Stretching
look at us
is
right
important.
now, it looks like we're in a Michael Jackson video.
Stretching is important. So this is going to help with the knee. But I watch people walk around dangerously sometimes, and your shoe choice can make an issue with your foot, your ankle, all the way up your kinetic chain.
Yeah.
So to avoid these things, when we're picking our shoes, something like a flip-flop, these loose straps can be an issue.
Let's just start with why mobility is so very important, especially as we age.
Mobility is the ability to move actively with full range of motion and good muscular control.
Okay.
Our bodies were meant to move, so we're constantly moving through our daily routine, and mobility is also helpful for being able to react to things like slips and falls. Okay, now we got our tech here. So this is the Smart Rope Rookie Donut. This is cardiovascular at home without the big equipment. So you've got this Rookie Donut
So it's
here.
not a full jumper.
Exactly, yeah. And the American Heart Association recommends 2.5 hours per week. So the donut here is going to add weight. It's going to feel like a rope, okay? But it's cordless, and it's amazing because you've got the cardiovascular work at home without the need for big equipment. You won't damage your ceiling or your floors. And these, the alloy ball bearings in here, take one home when you're done. These are awesome. If you're going to sit, you want to sit up nice and tall. Use those postural muscles so that you get the benefit of getting a little bit of a workout, but you're not slouching and creating that mid-back pain.
Do these really make a difference?
Yes, so the Dr. Scholl's work insoles with massaging gel work. So they are meant for people who are standing on their feet all day. I was running around in mine, and they work. So they've got massaging gel here that's going to help with joint impact forces. So strengthening the quadriceps is going to be moving through your available range, just like this. So this is movement-based when your joint is feeling okay. To slow down, take your time, and pay attention. The next one is to use the banister or the walls for balance. You can move your heels up like this, and that actually gets the blood pumping. But stopping, obviously, is the best. I always recommend once an hour. Usually it's 2 to 3 hours or every 100 miles.